Hello and welcome to this webinar, Climate Change and Health, hosted by SAPEA, Science Advice for Policy by European Academies. My name is Michael Creek from Sticky Dots in Brussels, and it's my pleasure to be your facilitator for this webinar and to welcome you all. Great to see so many people joining us. We're really looking forward to presentations from our panelists and also to a lively discussion at the end of the webinar. So we look forward to hearing your thoughts and getting you joining in the conversation. But first, a little bit about the background to this webinar. In June 2020, last year, the European Commission's group of chief scientific advisors published a policy document, a scientific opinion entitled Adaptation to Health Effects of Climate Change in Europe. And this piece of policy work informed the implementation of the European Green Deal, and is very clear about the fact that climate change has key consequences for human health. The increase in heat waves, for example, infectious and vector-borne diseases, extreme events like fires and floods. It really highlighted the effect on human health and the urgency of the need for action. So with this webinar, we were curious to bring you together to look at this notion of climate action for health. How can we use scientific evidence to integrate this notion into policy development right across sectors? And so we'll be digging into this scientific opinion to hear about its key recommendations. And also we're going to hear about how it's being integrated into policy tools like the EU Adaptation Strategy and the European Climate and Health Observatory. So very curious to hear more about this. Here's our agenda for the webinar. So in a moment, we'll hear from Professor George Griffin, the president of FEAM, the Federation of European Academies of Medicine. And then we'll start with our speakers. So Dr. Robin Fears, who is Biosciences Program Director for ESAC, European Academies Science Advisory Council. Next up will be Sir Andy Haynes, Professor of Environmental Change and Public Health at the London School of Hygiene and Tropical Medicine in the UK. We're also very glad to have with us Professor Karina Keskitalo, who is a member of the European Commission's group of chief scientific advisors, one of the 7, and she's Professor of Political Science at Umeå University in Sweden. And our 4th speaker will be Peter Loeffler from the European Commission. He's a policy officer at the Commission's Directorate General for Climate Action, known as DG Climate. And then, yeah, finally, we'll be opening up the discussion. So please don't hesitate to share with us your questions and comments as the webinar goes on. Okay, just a few points to note. So there are, as I said, 7 chief scientific advisors to the European Commission. And their mandate is to provide independent scientific advice based on evidence that has been gathered from across sectors. So this advice comes to the European Commission to inform how policy is made. The advisors write recommendations to improve the interaction between policymaking and science advice. SAPEA is science advice for policy by European academies. So yeah, together, the scientific advisors and SAPEA make up the European Commission's science advice mechanism. And within SAPEA, 5 member networks represent over 100 academies across Europe. So in that case, it's my pleasure to introduce our first speaker, Dr. Robin Fears, who is Biosciences Program Director at ESAC, European Academies Science Advisory Council, who's going to explain a little bit more about how we can use scientific evidence to integrate climate change and health solutions into policy. Dr. Fears, the floor is yours.
Thank you very much, Michael. Good afternoon, everybody. Let me just start slides. Okay, so here we are. I'm Robin Fears, as you heard. I am part of the Biosciences Program at ESAC. You also heard ESAC is part of SAPEA. So that's how I am. The next slide essentially provides in more detail what Michael said very briefly in his introduction. That is, what are the effects that we might expect from climate in consequence of the rise of greenhouse gas emissions, rising temperature, precipitation, rising sea levels, extreme weather events, and so on. The effects of these climate changes are influenced by various pathways, and broadly we categorize climate effects on health in terms of three things: direct pathways, so extreme heat or flooding; indirect pathways via ecosystems, so agriculture, for example, or infectious disease; and indirect pathways via socio-economic systems, so for example, the effects of migration or reduced labour productivity. It's a large topic that the opinion from the group of chief scientific advisors laid out very well. A lot of the points within this topic. I will focus on two things in the next few minutes, on infectious disease and on food and nutrition security. And I'll start starting points from the group of chief scientific advisors' opinion. And I'm taking 3 points here from the opinion. One is we need integrated policy action. I'll come back to this later on. I'm pleased to see from the poll that we have a substantial representation from the policy world. I think there is a lot to do for coherent policy across sectors and across disciplines, and I'll come back to that. The second point that I take from the opinion here is that we do need to look at cross-border issues. These are not issues just for member states, although of course many of you will know that a lot of health strategy and health delivery is devolved to the member state level. But there are significant issues here for the European Union, not least because of the cross-border threats, but certainly they are a major issue with regard to infectious disease. And thirdly, we need to focus on vulnerable groups, whether that's socio-economic groups, migrants, or the elderly, for example, or geographical areas like the Mediterranean. Okay, so a lot of what I will say next few minutes it is drawn from this report from ESAC that was published last year. I commend it to you, of course, the detail. But just say at this point that we were very pleased that this report was used by the group of chief scientific advisors as a reference source in constructing their opinion, and also that the SAPEA and the group of chief scientists called on some of our ESAC experts to help them with the group of chief scientists' opinion. Notably our co-chair, ESAC co-chair, Andy Haynes, who will be speaking next. Okay, so that's the background. In Europe, there's a range of pathogens and vectors that are of importance. These can be categorized, as many of you will know, as vector-borne. So examples here, both for human and animal disease, waterborne, and Vibrio, for example, is an increasing threat in the Baltic area, and foodborne, Salmonella, and so on. In many cases, for example, in the vector-borne diseases, the increasing threat is associated with an increasing distribution of the vector and the pathogen because of climate effects on temperature or precipitation. In some cases, there are other also local effects. So, for example, flooding may produce local environments conducive to vectors. The modelling work suggests that these threats of infectious disease are projected to increase, that they are being studied comprehensively by the European Commission's agency, the ECDC, in Stockholm. One recent example of work is this map from the end of last year that shows changing distribution of West Nile virus. We have other information in the ESAC report showing a projection of a further expansion westwards up to 2050 and beyond. So although it is sporadic in Central and Western Europe, it probably is an increasing threat, and it can be associated with climate change in these regions. Another example from infectious disease, or another two examples, dengue and Vibrio. The very comprehensive yearly report from the Lancet Countdown group that was published earlier this month. It's a global assessment that they do in Europe, obviously, as part of that assessment. But they looked at several infectious disease trends and confirmed that in Europe, for example, potential problems for dengue and Vibrio are increasing. Dengue is still a low-risk threat, but the environment for the mosquito vectors is increasing substantially over the last few years, as shown here. Vibrio, another example, as I mentioned, particularly in the Baltic and up into the Arctic, is now increasingly suitable as an environment for Vibrio, with a number of implications for health and economic impact. Now, tackling these infectious disease challenges really uses the same measures are required to tackle any infectious disease challenge, that is, new monitoring and early warning systems. And we do have some examples of good practice through the ECDC, new diagnostics, new therapeutics and vaccines. I'll come back to that in a moment, but also let me emphasize the need for continuing research. And I know also there's a substantial number of researchers in the audience, and I'll come back to some specific points for research after the next slide. This next slide advertises a recent publication from a workshop last year that was co-organized by ESAC together with our colleagues in the American Academies, NASEM, and the Global Network of Academies, IAP. And essentially the interest, of course, in the Arctic is worldwide, as well as Europe. The Arctic is warming at a faster rate than Europe, most of the rest of the world. One of those consequences of a rapidly warming is thawing of permafrost. And one of the consequences of thawing permafrost may be the re-emergence of pathogens, or indeed the appearance of previously unknown pathogens. So a re-emerging pathogen that was exemplified by anthrax over the last 20 years, but where there was evidence that clinical cases of anthrax were derived from the thawing of reindeer old burial grounds contaminated by anthrax. So there is a real issue there. There are also potential issues from the genomics and the discovery of entirely new viruses and bacteria. And obviously that's an issue for continuing research. In addition to the particular issues that may arise from thawing permafrost, of course, the rapid warming of the Arctic is associated with potential spread number of other infectious diseases. Already mentioned most West Nile virus, Vibrio, tick-borne diseases, and possibly even malaria in some of the regions. So obviously I don't have time to go into the detail of this report. General conclusions, and by general conclusions I mean, although the focus is on the Arctic, that the messages really are generalizable for the whole world. And also, gratifyingly, when I compared these general messages with the ones that are in the Group of Chief Scientific Advisors' opinion, that there is a lot of agreement. So things like the need for better surveillance systems, for working with Indigenous communities, for taking a One Health perspective, linking animal and human surveillance and responses, collaborating between across the public research networks and is interested in the Arctic in order to economize on the research infrastructure and share data. And of course, the penultimate bullet, use the data that we get from research to inform policy and practice. Again, it's complicated in the Arctic, so it has to be at local, regional, and global levels. But actually, I want to focus on or emphasize a final point that we've discussed in our work, but actually I don't think appears in the group of chief scientists' opinion. That is the need to continue investing in basic research. And you know, a lot of us in the scientific community consider this is absolutely essential for a number of reasons. But when we're talking about pathogens, for example, one of those reasons is to understand better the determinants of transmission within species, between species, determinants of infectivity and clinical course. And while nothing to do with the Arctic, some of the lessons from the recent COVID-19 experience, I think re-emphasizes this point for infectious disease research. We still need a lot of basic research. Okay, so let me to my second point, or my second starting point, which is food and nutrition security, where I combine some assessment both for mitigation and adaptation. Now, there isn't very much about food and nutrition security in the current chief scientist's opinion, and that's because they had earlier issued another opinion focusing on sustainable food systems. And I think it is worth bringing together some of the points from both those two opinions to show how a focus on food systems is critically important in considering the response to climate change and in terms of health. This slide derives from previous ESAC work with other academies around the world. I can give reference this material subsequently if you would like. Essentially, we were looking at a number of determinants of food and nutritional security, which map onto a number of the SDGs. So again, this emphasizes the point that really we do need integrated policy action to cover a whole lot of the SDGs and integrate, for example, approaches to agriculture with policy for land use, health, other natural resources, and so on. Okay, but coming specifically to climate change and agriculture, this is work from the European Commission showing it essentially mapped onto Europe the potential for various responses in terms of agricultural productivity, essentially crop yields, so that in parts of Northern Europe, in the UK, where I am, for example, but we might expect in some respects improved crop yields because of climate change. In Southern Europe, the temperature may exceed that which many crops are currently adapted to, and so there may be a reduction in the range of crops that can be grown and their yields. In Eastern Europe, maybe a mixture of high temperatures, changes in rainfall, increasing drought, and so on, which will have variable effects depending on the crop. This doesn't cover all of the issues, of course. However, in all areas, there is also the potential threat of new pests and diseases, but both for crops and for livestock. So it's certainly not enough just to consider what's happening to the temperature or precipitation. There are a number of variables, pests and pathogens, soil quality, and so on. But overall, the projections suggest that the effect on yield will continue to reduce over the next few years under climate change, and the effect on nutritional quality of those crops, fruit, vegetables, nuts and seeds that are so important in providing micronutrients, the quality will also go down. Okay, well, how should we respond as scientists and as consumers and as essentially the solutions categorized as two sorts, adaptation and mitigation, but both have to be implemented side by side. With regard to adaptation, as I said, we already expect significant effects of climate change on food systems, reducing crop yield. Those effects seem to be increasing over the last couple of years, and as I say, are projected to increase in the future. what should we do? Well, there's a number of scientific opportunities, for example, for breeding better crops and actually breeding improved livestock, more resistant to stresses such as heat, drought, pests and diseases. We know how to do this to a significant extent in plant breeding based on really excellent research that has been pioneered across a lot of Europe over the last few years. Europe is a leader in this research. It's not just biosciences research. We also need the lessons from social sciences research to understand the behavior of farmers, consumers, and manufacturers behavior appropriately. But the point I want to make at the end of this slide is that, of course, acting in this way requires not just great cutting-edge research that Europe is very good at, but a supportive regulatory framework in order to be able to use that research and translate it into innovation. That is, in particular, new breeding technologies and improved crops. And I have to tell you that Europe is not very good at this translational step. We have problems with a bureaucratic and overly restrictive regulatory framework for plant breeding, and maybe come back to that again in policy terms. But the second solution is mitigation, and this is important because agriculture itself contributes significantly to greenhouse gas emissions, about 30% worldwide. Animal agriculture, so livestock farming for meat and dairy, it is a large proportion of that contribution. Therefore, if we want to reduce agriculture's contribution to climate change, then we have to do a number of things. There's a list of actions that can be considered for changing farming practices, reducing food waste, and that's really a significant point to focus on in policy terms, and changing diets. And changing diets is important because if we could reduce the intake of red meat consumption, for example, where that is excessive, and there's a lot of research on where and how that could be excessive. So if we can reduce red meat consumption where it is excessive in Europe, then we reduce the need for livestock and their contribution to greenhouse gases, and we also improve consumer health in various ways. And I know Andy will come back to talk about some of this in more detail. I would add here is that it's might seem relatively easy to talk in abstract about changing diets, but we can only do that if we also protect vulnerable groups in Europe and elsewhere who may already be at risk of micronutrient deficiencies. And clearly we don't want to reduce their nutritional quality of the diets any further. Okay, so that just leads me on to, and I'm near the end, vulnerable groups in Europe. As I mentioned, there are geographical vulnerabilities. I talked about the Arctic, the Mediterranean, and the neighbours of the European Union in the Mediterranean, so North Africa and Middle East, are very vulnerable to climate change and health. Population groups are vulnerable in a number of respects: elderly, children, marginalised groups. The food and nutrition security, as I've been talking about, in particular, there's high level of vulnerability in obesity, and there's a high prevalence of obesity in Europe. And since austerity, we have an increased proportion of households unable to access the recommended dietary guidelines now. I want to make two other points just on this slide. One is that, of course, our focus today is on Europe, but we do have to acknowledge that actions by the EU have consequences for the rest of the world. And in climate change and health, this is particularly so. That is, if Europe doesn't reduce the greenhouse gases to the target level that it's promised, then that has implications for all the world. If Europe seeks to improve its, for example, sustainability in agriculture, but that may be at the cost of exporting lack of food sustainability to the rest of the world. And clearly we wouldn't want to do that. And that, I think, is an issue, for example, for the farm to fork policy that's now under discussion by the European Commission. The other point with regard to vulnerable groups is the potential intersection between climate change and COVID-19. I won't say anything more about this because I know Andy will focus on it, but there are challenges here and there are opportunities. Okay, coming toward, let me just say that if you've followed me so far, I hope it won't come as a surprise to you to hear that I think policy development has to occur across a broad front. Of course, we will hear about some critically important actions from Peter in a little while, but the European Commission does have to recognise that issues for climate and health are part of many other bits of policy. So, for example, that the current renovation wave for the construction sector, the Arctic policy, which is under modernisation at the moment, the previous Arctic policy, I don't think considered health at all. Well, the new one should. I've mentioned farm to fork, critically important in sustainable food production, but with implications for climate change and, of course, for health. And while the intentions of farm to fork are very good, there is a potential for inadvertent consequences, and there's also potential need for aligning with the Common Agricultural Policy. So, European Health Union and European Green Deal, I know will come up later, so I won't spend time on them, but just emphasise that health should be part of all policy thinking. And also the final point, action within the European Union has consequences for the rest of the world. I mentioned that. Vice versa, of course, the rest of the world has consequences for the EU. I think this year in particular is a great year for European leadership. We have COP26 hosted in the UK later this year. We have G7 hosted by the UK, and we have G20 hosted by Italy. These are all very important international events where climate change and health must have increasing visibility. And my last slide point, the EU cannot do these things on its own, part of the world. ESAC is part of the Inter-Academy Partnership, which is a network of academies around the world with 4 regional network groups, which ESAC is one. IAP currently has a project examining all of these issues for the other regions and the world, climate change and health, and the other regional reports will be published this year. So allow me to advertise that as a forthcoming interest to you all, and it will be followed by a global report on exactly these issues next year. So thank you very much. I think that was my last slide. And thank you for listening to me. Okay.
Good. Am I unmuted?
Yes, we hear you loud and clear.
Oh, good. Well, first of all, sincere apologies for my difficulty in signing in. WebEx is beyond me, but after an hour, I managed. So I will now come back. George Griffin is my name from FEAM and Federation of European Academies of Medicine. And I will introduce the speakers now and then hand over to Michael for the moderation of discussion. So Robin, thank you very much. That was very clear and highlighted the complexity of the situation. And one thing you didn't touch on, of course, is the political aspects of this. When you have certain politicians who don't accept climate change, this makes the whole thing even more complex. But thank you for being so clear with that. So we move on now to Sir Andy Haynes, who is a friend of mine and a great advocate for the understanding of climate change and its effects on populations and on individuals. Andy is a senior professor in the UK at the London School of Hygiene and Tropical Medicine. and is really leading this aspect from the academic point of view with great clarity in the UK. So Andy, we look forward to hearing what you have to say. Over to you.
Many thanks, George, for the introduction. Hopefully you can hear me loud and clear.
Yes.
Good. So what I'm going to do really is to follow up on what Robin's already said, to broaden the perspective somewhat, to include a discussion of mitigation and health, but also to make the case, of course, that we need to integrate and synergize between adaptation on the one hand and mitigation on the other. And that was a point also made by the scientific advisors. But currently, those communities often don't talk enough to each other. I'm going to talk briefly about how we emerge from COVID-19 towards COP26 on a more sustainable strategy, trajectory, and the role that health can play in doing that. So hopefully, if we're reasonably optimistic perspective, suggests that we could be at a turning point for our planet and our health if we can really make use of some of the changes, the policy changes that have occurred as a result of COVID, capitalize on them, and emerge from COVID in a more resilient and a lower carbon trajectory than we have at the moment. Certainly, we have to build our recovery on solid foundations that will not undermine the health of future generations. And of course, the last year has really demonstrated the need for resilient health and social care systems, as well as renewed focus and public support for global health priorities. We need more solidarity within Europe, but also between Europe and the rest of the world, as we've already heard. So COP26 provides the opportunity really to develop a more coherent and united vision on an evidence-based path to a zero carbon, resilient and more inclusive global economy. During COVID-19, of course, there have been some changes in the global and local environment. One example is the decline of air pollution that we've seen in a number of countries. This slide, a quite striking slide, was the decline of nitrogen dioxide over India that occurred fairly early on in the pandemic last year. You can see that for many people in northern India, for example, the Himalayas became visible for the first time in decades as a result of the declines in air pollution. And you can see the decline in nitrogen dioxide over India as a result of reductions in transport, particularly surface transport, of course, but other factors involved as well. We also know that during COVID lockdowns, there was a reduction in PM 2.5, fine particles. Fine particulate air pollution, of course, is a major driver of ill health. This paper in Lancet Planetary Health suggested that as a result of these reductions, these short-term reductions in fine particles, there was a number of deaths, quite substantial, perhaps 20,000 deaths or so averted in China, and much less, but still some deaths averted in Europe as a result of short-term reductions in air pollution, and probably more if we factor in long-term avoided premature fatalities. Some evidence, not yet definitive, but suggestive, that exposure to air pollution itself might increase COVID-19 deaths. And certainly air pollution does increase the risk of heart disease, stroke, chronic obstructive pulmonary disease, that are all conditions that have been associated with increased risks of adverse effects from COVID-19. So it's not proven, but it's a plausible association. And as we see, if we look at the greenhouse gas emissions, you can see that there was a big and precipitous decline in April. China was first, of course, in February, big dip in China, and then other economies followed suit with these big dips in April and May. Some recovery, but not to a full extent. And of course, we still don't know what the effects of the continuing and sporadic lockdowns in various parts of the world are going to be on emissions. But we do know that roughly for 2020, the emissions overall were about 7% lower than 2019. And you will recall that in order to reach the Paris Agreement target of 1.5 degrees centigrade, which will be very tough to reach, but if we are to reach it, we need to decarbonize probably slightly even greater than that, percentage terms, but year on year on year. So what this shows us is that the rapid reduction in greenhouse gas emissions as a result of COVID is not the way to decarbonise the economy. It's been, of course, very disruptive, with dramatic effects not just from COVID, but also dramatic effects on mental and physical health of the economic impacts of COVID. So it's a lesson, really, that what we need is planned decarbonisation, with an eye on health. So ensuring that we enhance, where possible, equity, and that we sustain and improve health in the face of these challenges. So where are we now? Well, since the political transition in the US, we can have some cautious optimism that if we implement the policies that have been agreed by the EU, by the incoming Biden administration, by China, and by others, we could be within striking distance at least of the 2-degree Paris Agreement target, about 2.1, if we can implement all those commitments that have been made by various important players around the world. Current policies would take us close to 3, which would be in many ways disastrous for humanity. There is pretty good evidence as we go above 2 degrees, the risks of extreme threats to health increases, including through sudden discontinuities, state shifts in systems, which could drive us to a much more hazardous future. So we need to stay below 2 degrees, and we can build on some of these commitments that have already been made, and hopefully drive them even below 2 degrees. So what does the COP26 campaign aims? There are 5 broad aims in the COP26 program. You can see that the adaptation resilience, we'll hear more about that from subsequent speakers. I won't say a great deal about that, but it's certainly absolutely important to adapt to those impacts that we can't prevent, but also to prevent through mitigation those impacts that we can't adapt to. The energy transition, of course, is vital, moving towards zero carbon, equitable, clean energy. Clean transport, accelerating the transition to zero carbon road transport, particularly phasing out petrol and diesel engines, bringing in electric vehicles, perhaps hydrogen may have a role too. But in cities, of course, enhancing active travel, walking and cycling, and hopefully as the COVID vaccines come in, also re-energizing public transport, which is obviously something we need to do for our urban centres. Nature, protecting and restoring natural habitats and ecosystems on which our civilization ultimately, of course, depends. And those can be important adaptation strategies, but they can also be mitigation strategies too, because intact ecosystems can lock in carbon and help to increase uptake of CO2 from the atmosphere. And finally, finance, a transformation of our financial system so that all countries have access to funds for climate investment, both for adaptation and mitigation. Well, none of these themes are specifically about health, but they all have health dimensions, of course. We'll hear more about the effects of adaptation strategies on health later. Of course, clean renewable energy will reduce air pollution deaths. Promoting sustainable urban transport systems can help us to reduce air pollution, increase physical activity. Protecting and restoring nature can improve mental health. Contact with nature improves mental health. But we also need to be cautious to make sure that we design those nature-based solutions in a way that we don't inadvertently increase infectious disease risks, for example, from vector mosquitoes, or Lyme disease, or whatever. And of course, finance means investing in climate resilience health systems and valuing the health gains from carbon mitigation and adaptation policies, and including those valuations in our economic strategies, ensuring that we phase out fossil fuel subsidies and reform carbon pricing. So the WHO's manifesto for a green recovery points the way in which we can start to do that. They have 6 prescriptions for a healthy green recovery. Many of them are highly consistent with those 5 parts of the COP26 campaign. And you can see that there's a lot of overlap between them. They also encompass promoting healthy, sustainable food systems and building healthy, livable cities, both of which, of course, are key to success. And of course, as I mentioned in the previous slide, we must stop using taxpayers' money to fund pollution and broader activities that undermine our own futures and environmental sustainability. There are major potential health benefits of the EU Green Deal, of course, itself. and we and others have started to write about some of those health benefits. And if we can value those health benefits, they will increase. That will increase, I think, the appetite and the ambition for rapid change. You can see again that the European Green Deal includes this commitment to supply clean, affordable energy, clean energy, mobilizing industry for a circular economy, much more recycling, reuse, remanufacturing, which, if properly regulated, can provide a great deal of employment, reduce carbon emissions, and also improve health. But we have to be careful that we don't inadvertently damage health, for example, by allowing the leakage of persistent organic pollutants into the environment or whatever. We also know that preserving and restoring ecosystems, I've already mentioned, can help to sustain health. And Robin's already mentioned the importance of farm to fork and how that could, if it was well designed, help to drive us in a virtuous circle towards lower environmental impacts and healthier diets. So there's a great deal that can be done to improve health and decarbonize the economy, capitalizing on some of the vision of the European Green Deal. Let me give you a few concrete examples. If we were able to phase out fossil fuel burning, a paper that led by our colleagues at the Max Planck Institute for Atmospheric Chemistry in Mainz a couple of years ago, suggested that we could prevent about 3.6 million premature deaths a year from ambient air pollution. That's caused by breathing in largely, of course, of fine particles from fossil fuel burning, about 400,000 in Europe. So some major health co-benefits of decarbonizing the economy and moving away from fossil fuels. Redesigning cities, of course, brings major opportunities for health improvement as well. This is some examples from our colleagues in IS Global in Barcelona. They've been doing a great deal of work on evaluating the impacts of green space. And they've suggested, for example, that there are a number of health benefits of natural spaces shown on the left side of the slide. The dark text shows you where there's well evaluated, robust evidence in terms of improved life expectancy, better general mental and physical health, including reduction of cardiovascular and other diseases, and probably improved cognitive performance as well. And possibly, and this is emerging evidence in children, potential benefits to physical and mental health as well, as shown in the grey text. One specific example is this strategy of superblocks. So in Barcelona, they developed this idea of amalgamating city blocks, bringing them together, stopping through traffic, allowing people to walk and cycle safely, giving them greater exposure to green space within these superblocks. And they've estimated that if that could be scaled up to the whole city, that would bring quite substantial benefits in terms of reduced air pollution and also improved physical activity and concomitantly improved physical and mental health. We've done work in the UK, looking at the benefits of active travel and low carbon transport. This particular slide just is a kind of thought experiment of what would happen if we could get the urban population of England and Wales walking and cycling like the population of Copenhagen, which, as you know, has some of the highest walking and cycling rates of any city. And it shows you the benefits in terms of economic, the costs averted to our National Health Service if we could do that. And it shows you that the costs averted to the National Health Service would increase over a 20-year period because there's a lag in the benefits being accruing for many of these, but they could affect diseases like diabetes, dementia, heart disease, and stroke, all of which are related to physical inactivity. And providing more opportunity for safe active travel is therefore a great public health measure, as well as contributing to decarbonisation. The housing sector too, not just building new houses that are cleaner, much lower energy impact, much better indoor environment, but also retrofitting our old housing stock. Again, this is a study we did a few years ago, looking at the benefits of retrofitting the housing stock in the UK using combined insulation and ventilation control improvements to reduce energy use, improve the indoor temperature, but also reduce household air pollution. And we estimated that perhaps 5,000 lives a year might be saved. This photo just shows you, it's an infrared camera, and shows you the reduction in energy loss. Red is the unmodernized building, the right, the purple, is the modernized building. You see much less heat being lost from that building. So big potential benefits in terms of reduced greenhouse gas emissions. but also improved human health through better temperature control and less household air pollution exposure. And then finally, the healthcare system itself, which we're now recognizing is a major contributor to climate change. If it was a country, it would be the 5th largest emitter on the planet, something of that order. About 5% of greenhouse gas emissions come from the healthcare system. And NHS England has recently contributed or committed to net zero emissions by 2040 for direct emissions. That's the scope 1 emissions on the right side of the slide, the fossil energy burnt on site, on health facility sites. Also for indirect emissions by 2045, that's the electricity they buy in, but also their supply chains, so medical devices, pharmaceuticals, vaccines, transport of patients and staff, and so on. So that's an ambitious aim, but that's what they've committed to over coming decades, and that really offers us an opportunity for the health sector to contribute to decarbonising society. And then the nature campaign, the COP26 Nature campaign, aims to build a new dialogue on sustainable land use and trade between agricultural producer and consumer countries, delivering, as we've already heard, nature-based solutions, which if they're well designed can improve health, but they have to be designed carefully, securing political commitments to concrete actions, integrating land use change, the protection of biodiversity, indigenous protected areas, and climate change mitigation, and a just rural transition. We can't just, of course, focus on our cities, we also have to make life better for rural populations as well, and to increase ambition and awareness of the potential for ocean ecosystems, which we're beginning to understand have major benefits for not just for adaptation to climate change, but also mitigation. The oceans are a major carbon sink. Our food systems, major contributors already heard, and this is the planetary health diet that was advocated by the Eat Lancet Commission. They suggested that if we could get universal uptake for this planetary health diet, it may be possible to prevent perhaps 10 or 11 million premature adult deaths per year by mid-century. And the diet, of course, involves much less red meat, much less dairy product for high-consuming populations, not for the whole world, but for high-consuming populations. Most of them need to be eating more fruit and vegetables, more whole grain carbohydrates, and more nuts and seeds. And that's the sort of broad direction of travel that we need to go. And of course, there are many implementation challenges that I don't have time to go into. One of them, of course, is affordability. We can maybe come back to that in the discussion. And as I've said, restoring ecosystems can play a role in adaptation, regulating fresh water quality and quantity, providing flood protection, as well as carbon sinks. And the ocean-based mitigation is summarized here. This is a recent, very interesting report by the high-level panel for a sustainable ocean economy, which I would recommend to those of you who are interested. It would be very important, I think, to downscale this a bit to Europe and look at what the implications for Europe might be. But there are a number of promising strategies. Obviously, offshore wind is pollution-free. Domestic shipping is a major contributor to air pollution in some parts of coastal communities, so decarbonising that can be important. Seaweed farming is environmentally very friendly, potentially nutritionally beneficial as well. Mangroves can help protect against flooding, and so on. So a number of potential benefits there. So in conclusion, how climate friendly is the current post-COVID stimulus are these packages? Well, unfortunately, it's a very, very mixed picture. This is a recent assessment by Vivid Economics and Economic Consultancy. And what you can see is that the green lines show us the positive contributions to climate change mitigations, and the red show us the negative contributions. You can see that overall the EU is doing pretty well. A number of other European nations are also doing reasonably well. But after that, it gets a much more mixed picture. And rather disappointingly, China invests some in greenhouse gas mitigation strategies, but there's an awful lot of investment in fossil fuel energy too. Hopefully the mixture of the US investments will likely change dramatically with the Biden administration. But at the moment, it doesn't look as promising as many of us has hoped it would be. So in conclusion, let me conclude by saying that, of course, there's a lot that adaptation can do to help reduce the health effects of climate change, and mitigation can bring near-term benefits to health, as well as the longer-term benefits from decarbonising the economy, reducing the risks of dangerous climate change. improved health can be an important driver of increasing policy ambition. This is one example, the Race to Zero coalition, over 1,000 businesses, 450 cities, over 500 universities, and 120 countries are joining together in the largest ever alliance to make the case for a race to zero, net zero emissions by 2050. And we believe that the health argument, the fact that we can improve health as well as addressing some of these environmental imperatives, will be a mobilizer of public opinion. We know that after COVID, more and more people are concerned about their health and the health of their loved ones. And therefore, there is an unprecedented
I think we might have lost Andy there a second. Let's see. Perhaps, George, you'd like to introduce the next speaker, and we can perhaps come back to Andy to finish his presentation. I think you're still on mute at the moment.
Can you hear me now?
Yes.
Good. Well, if Andy was here, I would say every time I hear Andy speak, he brings something new to the table. And that's really fantastic. One of the things about research and science is bringing clarity and hopefully simplicity to highly complex, multifactorial aspects. And climate change and leading towards zero carbon is exactly that. You move one thing and something else moves. Andy manages to make this very, very clear. And I think in the discussion at the end and in the summing up, we'll see just how important this clarity is. One thing that Andy didn't mention, which I think is really important, is education. And that is education of young folks. My daughter is a primary school teacher. She teaches about smoke, about smoking, about the atmosphere being so important. And these are the people of the future, of course. But as Andy said, it will take time. It will take time to achieve what we all would like to see. But I'm sure we'll come round to this at the end in discussion. Well, the next speaker has been absolutely pivotal in this in the evolution of this discussion, because she is a member of the group of chief scientists in the EU. There are 7 of these scientists, practically all basic or social scientists, and Karina Keskitalo is one of the leaders in this field, and in fact was pivotal in organizing the opinion which the group of chief scientists published, and you see the coming on the screen now, the title of the opinion. And Robin mentioned this opinion and how ESAC had taken a role in this. So it's a great pleasure to introduce Karina as being very, very important from the GCSA, the group of chief scientists, and she will tell us about the work that she and they have been doing. Karina.
Excellent. Thank you so much for that kind introduction, and thanks everyone else for also prefacing a lot of what I will talk about. I think we have some connectivity issues, so I guess our cameras are off, but at least you can see the screen, I hope.
Yes, we hear you fine.
Excellent. Yeah. Thank you.
Andy seems to have disappeared, by the way. I don't know what's happened there.
Yes, I've seen some connectivity problems, but I mean, hopefully you will hear this, and otherwise I can try to return.
Yeah, I can hear you fine, Karina.
Excellent, thank you. So I'll talk about this opinion, and I'll also talk a bit about the group of chief scientific advisors and how this group works. And I'll try to also connect to some of the issues people have mentioned so far about other opinions we've done, and also a bit of the recommendations that people have already asked about the other speakers. let's see if I can switch. Yes, here we work with a unit that provides us this nice little graphs. But this is a little simplistic illustration of how it's supposed to work. You have these 7 people. We get assignments directly from the commissioners or of our own volition, where we often continue earlier opinions because we realize that there are, need for expanding on them. We worked on, for instance, sustainable foods from the ocean, and then we worked on sustainable foods, these type issues. But most often we get a question from the commissioners, leading to the idea that we are developing scientific advice, often, or in most cases actually, building on the work of SAPEA, which has this excellent network across Europe from all academies. And then the idea is that this then goes back into the commission process, supports proposals for policy or legislation, because these are often the types of questions we get from commissioners, which relate to coming policy or legislation, and then hopefully leads to better policy making and legislation outcome for citizens. So it's very much built on the idea that science advice is a crucial part in policy development. And this is another little quick illustration. The way it usually works is that SAPEA usually establishes working groups, which then review scientific evidence. You see these small balls at the bottom of the page. Consult with the scientific community and produce an evidence review report. And in this specific opinion, we actually didn't do that because we drew on the ESAC existing report and then added to that through work in the unit. And the ESAC report you already heard about. And then we developed the opinion, the scientific advice, and also check viability of our suggestions in, for instance, stakeholder meetings. How long will it take? Will it be expensive? How doable does it seem? These type of issues. But it's all built on scientific advice, or the best science from all science, the full range from technical, natural, social, human sciences. That's the idea. And this is the some of the opinions we worked on. And if you look at the top row here, you see some of the early ones, and then you also see food from the oceans. And this actually alludes to some of the issues people have mentioned so far around ocean farming and seaweed and so on. So that type of advice is available there. And if I then show some of, this is just to illustrate, but you can find all of these on publicly available. So I'll just show some of the more recent ones, most recent ones, I should say. And here you see the sustainable food system one, towards a sustainable food system, which to a large extent takes up some of the issues that I think Robin mentioned, or that was mentioned a bit throughout. And I can talk to that one as well. I'll try to say something brief. So this is the way we work and how we develop opinions. And as you heard earlier, it's not an opinion as opposed to fact. It's an opinion which is recommendations built on scientific fact from a full scope of disciplines. Or if we judge so, for instance, if we judge that scientific advice has previously, for instance, built on more natural technical sciences, then we might also develop a sort of science report, which has been did on sustainable foods. So we really try to work across disciplines and also add to existing advice rather than duplicate it. That's how the group works. And in this specific case then, that dealt with climate change and health, this was the question that we dealt with. And you've already seen this a bit prefaced by earlier presentations, which adaptation measures could strengthen the resilience of the health sector in Europe in view of climate change. That it was a specific focus on vulnerable groups and different areas, and also some of the issues that were mentioned in relation to the ESAC report, vector-borne infectious diseases, heat waves, for instance. So this was the focus of our work, and this is how we progressed on it. We started developing the scoping question, which you saw on the previous page, checking, who needs this advice? Is this the question they want answered? So this is the way we usually interact with policy in the start, to make sure that the advice we provide is actually usable and needed and speak to relevant policy questions. And then we go to science and get the answers. And in this case, as I mentioned, we built on the ESAC report, We did a literature review in SAM, the scientific advice mechanism. We had expert elicitation, and then we also checked the recommendations with stakeholders as to viability, for instance, and cost and these type of issues, timing. So what I'll do now is I'll go through the main recommendations, and this is just to give you a flair of what's in the report. And I think you will also recognize quite a bit of this from the previous presentations, which have, as I mentioned, very much prefaced this, which is as it should, because this does build on the type of evidence that they have you've just heard in the two previous presentations. So the first recommendation, and this is actually quite similar to other recommendations we provided, for instance, on sustainable food, and this speaks to the need of integration. And here it's about integrating human health into all climate change adaptation policies. But for instance, with sustainable food, we've also noticed that, you know, traditionally policy has been made more in silos, maybe. And the integration, so that you actually look at very large health and climate perspectives, for instance, or very large food perspectives. And as we looked at in the oceans, food from the oceans report, also linking, you know, where do we get foods from the oceans and where do we get it from agriculture? This integration is crucial. And here we highlighted it through this main first recommendation to integrate health across all sectors and governance levels, that the EC should offer strategic direction and coordination, even when it does not have subsidiarity, for instance, and then try to work towards an evidence-based assessment and also actually closing evidence gaps. I think someone, maybe Robin earlier, commented that we didn't have a recommendation on continuing basic research, but actually if you look at the very end of this recommendation one, we do have a little, I think, half sentence on that. It's a lot of stuff to cover in one opinion, but we do have a short-parted recommendation on that. So this all sounds great, but how does one do it? And then we actually do in this opinion also have suggestions on how to do it, recommended policy actions to deal with the suggestions for each recommendation. And for this recommendation on increased integration, we suggest, for instance, that, well, one would have to look across land use areas. What is the role of health in urban, spatial, and coastal planning? Some of the issues you've heard about already, which is building design, infrastructures. And these are direct quotes, a bit shortened from the opinion, supporting the incorporation of health-related climate-neutral climate adaptation measures in building and infrastructure standards and codes. And you saw suggestions in previous presentations for needs for refitting and these type issues. And then of course also integrating adaptation with disaster management, water and food supply, and this speaks then a bit even more broadly than this opinion to the other opinions I mentioned, dealing with ocean issues and food issues, and also a way in which you can, you know, develop synergies then across these multiple areas. And I think we mentioned several areas in the opinion as well: the Green Deal, SDGs, the Sendai framework for disaster risk reduction. And then we also suggest, and this is also a bit similar in this, you know, how to do it for recommendation one. This, what is on the slide now, that's also a bit similar to what we have recommended in other opinions, that there is a full mix of policy interventions available. I mean, if you look at foods, for instance, one has often chosen voluntary measures, but in our foods opinion and the underlying SAPEA report, it's actually quite clear that, you know, voluntary measures aren't enough. If you look at science about what instruments work. So this is similar to what we have suggested, for instance, in that opinion. And here we suggest used in time mix of policy interventions available. This would be, for instance, blending health-related requirements into national adaptation, or the guidance, of course, since this is EU level for national adaptation strategies, providing targeted funding to multiple types of adaptation projects, city-level risk assessments, local planning, risk assessment, these type of issues. And here in the very end of this page, if you look at in the action opinion, this is where we also then talk about evidence-based assessment more generally, and then also about the need for basic research where there are knowledge gaps. So that's the first recommendation. which deals a lot with the integration. The second deals a lot with basically the health sector, and this then also speaks to the current pandemic and the issues why we now sit in front of our screens instead of in the same room, actual room, and not, you know, Zoom room or so. The fact that we need to in some way work on how to make the health sector more resilient even under pandemics and under change. And of course, this is again an issue where, yeah, there's different responsibilities. So what we suggest is that the EU uses its complementary role in health policy to support capacity and preparedness of the health sector, for instance, to deal with issues that are more within an EU purview, such as risk strategies, surveillance, monitoring, assessment. And also here we have a number of suggestions how to do it. And the most crucial is then issues that actually relate to strengthening the health sector itself, which is of course important for multiple issues, as we've also heard in previous presentations. Education and training, organize availability of critical components, and I think this is quite recognizable to anyone under the COVID epidemic, stocks of equipment, medicines, vaccines, and testing capacity to mitigate any health care crisis, which can of course come from other things than just COVID. Support improving basic infrastructure, and then also developing infrastructure in relation to heat waves, other health risks. And of course, considering cooling, heating solutions and the energy costs of them, so that one doesn't, you know, build oneself into energy costly systems. And for instance, just whatever the English term for this is, but costly cooling systems for summer, then maybe instead one should look at, you know, infrastructure design or different house types and so on. And if we then continue with how to support health services, the continuation of how to do it is about improving infrastructures at EU level, considering creating a disaster risk and climate change and health knowledge center, extending capabilities of the EU to deal with cross-border threats. And I think we heard a bit about this also earlier, relating, for instance, to infectious diseases, further supporting or developing the European Climate Adaptation Platform. And I think we will hear quite a lot about this in just a bit from the next speaker, and supporting surveillance, monitoring, and assessment. And this is not just, you know, the actual monitoring and assessment, but also in the integration, as it says later on in this text. Integration of environmental and health data sets and interactions between different agencies. So again, the integration point. And then to get to our final recommendation, this of course then leads to the question that was given or developed and also in interaction with DGs. How do we then design policies to support the most vulnerable social groups and geographical areas? A direct response to the question we were given. And of course, then we would have to know what the areas that are vulnerable are and have this type of monitoring that we talked about, and also look at it in a social way to develop socially just adaptation measures. And if we then look at the how to do it part for this, it's again a lot about integration and synergies, building an infrastructure design. And here we get again some points which have been, you know, relatively well covered and actually a risk under COVID, designing elderly care homes, providing maybe dedicated measures for the elderly in heat health plans, and in preparedness for disease outbreaks. And of course, we published this in the very start of the COVID. So we also had a little, you know, box on COVID and how that may be a sort of stress test for this type of issues, or for issues around resilience in healthcare, for instance. Yeah, and of course, as I just mentioned, have an understanding or develop an understanding of multiple vulnerabilities, who are vulnerable and to what, and how it may impact different groups. Again, the elderly group as an important one. And then try to actually integrate different monitoring and data sets to be aware of where are these vulnerabilities. And again, a bit similar to other opinions, we will also look at the fact that, you know, this happens across levels. Much of this will need to be maybe local. Some initiatives are doable at some places and some are not. You know, countries are different, and regions are different, and localities are different. So then one also needs to support local policies and initiatives, for instance, existing initiatives towards social just adaptation. So that's a very quick run through of things you have partly already heard and how this was, summarized in this work. And of course, as I mentioned, it's also linked to other of our opinions. So I think I will finish there, and yeah, feel free to ask any questions later. Thank you.
Brilliant. Thank you, Karina. George, I think you're having connection issues.
Yes.
Great.
Well, thank you, Karina. That's a very, very clear explanation of how evidence leads to policy at both the local and the international level, and how interrelated all of the areas that we have been considering are: the air we breathe, the health of the oceans, vector control, which can lead to infection. Very, very complex. But at the end of the day, there has to be policy. And this policy is meant to make things better. And that depends on evidence. And that leads us very well into our last talk today by Peter Loeffler, who has an intriguing title, Coming Soon. So we have things to look forward to from Peter. But this is just how the EU adaptation strategy has been evolved and is evolving. And you'll remember at the end of Andy Haynes' talk, he showed that the EU was right on the right-hand side of achievement in moving things along. And it's a great pleasure to introduce Peter, and we look forward to what's coming, Peter.
Thank you very much for giving me the floor, George. I hope you can hear me. And yes, there was actually an interesting graph which Andy showed, and I took a screenshot of it. Nice to see that we come out, overall well. Not so good to see other world blocks trailing behind, and quite clearly there's a lot of work still to do. Let me just share my screen. I think you should be seeing this now. So good afternoon just to everyone, really, once again. Thanks for having me. It's great to be in the room with so many interested and interesting people. And it's also nice to sort of reconnect again with EASAC and our group of chief scientific advisors. I'll focus in my talk on the EU adaptation strategy and the European Climate and Health Observatory under the promising title Coming Soon. But before I do that, let me just sort of broaden the picture slightly. And as you will see, Andy stole part of my thunder because I pop up exactly the same graph which he has shown. But hey, great spirits think alike. And this is actually a good graph to show that at the core of the Green Deal project is sort of this idea of a really transformative change to a more sustainable economy, leaving no one behind, so strong notions of equity and fairness. And you see with this policy grouped around sort of this core that there's increasing realization just how interconnected many policy areas are, and that in order to address sort of the core of the Green Deal, will have to converge more. And this is something which I think is really strongly felt in the Commission, and which we are really sort of, really getting geared up to work on that agenda. Now, I will focus, you see that on the top left, quite a lot on the climate ambition. But Andy rightly said that health is actually sort of a horizontal theme in many of these blocks around the circle. And is sort of a horizontal theme, and that is sort of almost a reminder of when the Commission President Ursula von der Leyen came into her current position and was setting up the new Commission. She produced her guidelines, a union that strives for more, her political guidelines, where you would read that as a physicist, I feel passionate about health. So we are in a lucky position to have her with this understanding of the importance of health, and also sort of, again, this comprehensive notion of health, that health of sort of individuals of the globe need to go together. But back to climate and climate policies. This is another graph which seems to show everything, but it's a bit hard to sort of decipher. But I will focus really on climate mitigation policies, i.e. the cutting of greenhouse gas emissions, and on the bottom, climate adaptation, i.e. adapting to climate change, which to some degree, unfortunately, is locked in. Now, on climate mitigation, we have right now a very sort of strong ambition in the EU. The ambition, and this is really at the core of the Green Deal, the ambition is to make Europe the first climate neutral continent by 2050, i.e. no net zero emissions of greenhouse gas emissions. And important also that this has to be an international ambition. So this is something which is in line with the Paris Agreement goals. We have been submitting this to the United Nations Framework Convention on Climate Change in March 2020. And speaking of international, of course, it's great also to see that the US government has joined once again the Paris Agreement and actually the climate neutrality ambition. So together with China, South Korea, Japan, and a couple of other important countries, there is now really, you know, the balance is tilting towards that ambition overall, and that's really good news. Coinciding with its submission of the climate neutrality target to the UN, the Commission also proposed in March last year a new EU climate law to enshrine this climate neutrality target firmly into EU legislation, and by the way, also make climate adaptation for the first time a legal obligation, both for the EU and its member states. And as an interim target, in September 2020, the Commission has put forward a plan to further cut emissions already by 2030 to by at least 55% compared to pre-industrial levels. And this is up from 40%, which was the previous target. And member states were initially, well, some member states were initially a bit reluctant, but they all sort of joined that ambition and agreed on the 55% in December. Andy also, and I think Andy and other speakers pointed out the significant and really near-time health co-benefits of both the climate neutrality ambition and of policies to decarbonize the economy. I picked this nice graph up in a German news portal. It's based on data from the European Environmental Agency on PM 2.5 emissions or fine particulate matter emissions in December and up until now. And you see sort of the black spots really in Poland and in Italy. Poland quite strongly linked to the predominance of coal in the power sector of the country and the widespread use of heating with wood and wood stoves in the country. And of course, this comes with a significant health cost in terms of both morbidity and mortality. And of course, the message is quite clear that as we have policies to decrease fossil fuels and to decarbonize the economy, we will realize at the same time significant health benefits and actually health cost reductions in the order of several hundreds of billions of euros per year. Now, the bad news is no matter how well and how quick and dramatically we manage to cut greenhouse gas emissions, climate change is here and it is here to stay at least for this century. This is a caricature which I picked up in another German portal. Well, yes, that's my home country. And I like this quite a lot. You know, this is climate change knocking on the door of this the small tiny man in the right, and he says, "Oops, this is sort of a bit inconvenient. You know, I would have expected you in a couple of decades." And I think this caricature brings across quite nicely just how early and how hard climate change hits us. You know, we had record-breaking temperatures again in the last 5 years. We had a huge heat wave in 2019. We had forest fires. We had a significant drought in Central and Eastern Europe. So that's the size of climate change and the element of surprise here. And that actually the element of surprise in itself is surprising because the writing is clearly on the wall. So how comes the man isn't really prepared and is so much surprised? Because all the evidence is here. We know that climate change is happening. We've got, you know, here is sort of the temperature change in Belgium. And of course, it doesn't require a lot of fantasy to just see how, as we turn to the right and go beyond this graph, this is turning red, and we may have to invent another color really to depict temperatures never seen in the country. And we, in our unit, actually calculate, right now we are already 1.2 degrees Celsius above pre-industrial levels. With current policies, we'd rather estimate that we reach up to +4 degrees by the end of the century, which would be absolutely devastating. if all countries meet their national determined contributions under the Paris Agreement, we may be able to reach something like 3+ degrees. But in any case, we see a significant risk of going beyond the +2 target under the Paris Agreement. Sorry, hitting the wrong button here. Okay, so it is really time for adaptation to climate change, and this means anticipating the adverse effects of climate change, taking appropriate action to minimize the damage which they may cause, and taking advantage also of opportunities they arise, sort of prevent the preventable, but also adapt to the non-preventable. We have a new EU adaptation strategy in the pipeline, which there was already an adaptation strategy in 2013, and we made a lot of progress in that. This is still an emerging policy field, but this new strategy, we think, is a completely different animal compared to the previous one, and it will have to. And the ambition here is really to improve knowledge, reinforce planning, and accelerate action with a much stronger focus on solutions, innovation, implementation, and prevention. It will be a very comprehensive strategy. I mean, mind you, we've shown the Green Deal graph. You cannot do, adaptation is something that concerns really everyone and all of us, and everyone needs to contribute. So there will be parts of the adaptation strategy focused on finance and the climate protection gap, as we call it. Sort of there is a need to work hard on improved data knowledge and know-how. Climate proofing of infrastructure and building back better is an important part of the agenda. We will need to work hard to adopt forests, agriculture, land use, ecosystems overall to climate change. It has been said already, rightly, a lot of adaptation is local, so working in and with cities and local communities is paramount. This strategy, unlike the previous one, will have a whole chapter on reinforcing global action and on the international dimension of adaptation, because we sit in the boat together. And last but not least, health. We will be flagged as an important area in the adaptation strategy, but again, as shown in the Green Deal graph before, health is really a horizontal theme. So if you work in cities on data, on finance, on forests, agriculture, and land, there are always health aspects. The timeline, just once again as a reminder, 2019 Green Deal communication, 2020 proposal for the EU climate law, and 2021 expected actually now in late February. I can even say 24th February is the expected date of adoption of the new adaptation strategy by the Commission. We hope to have the new strategy in place and can then move towards its implementation. And of course, we are sort of in the glad situation that, in the good situation that on health, we had a number of major reports recently and a lot of expertise. And you see on the top left, sort of some opinion and the EASAC report, and they join a whole number of additional reports, all of which, or most of which I actually have been reading and have been going into the adaptation strategy. By the way, this will be a very short strategy also, so health will be mentioned there, but don't expect it to cover 25 pages. But it will find its place. And so, of course, the writing is on the wall. Climate change will come with negative impacts on health or increased risks, and it will put growing stress on health systems and on their capacity. And so policy action will need to work in the traditional health sector, but go far beyond it and work on the root cases and all the systems that one way or the other have to have an impact and sort of have an importance for our health and health resilience. We also know that we need to fill urgently important knowledge gaps, that we need to strengthen the evidence base to feed into both policy making into practice. And whilst there is a lot of knowledge out there, we, in our internal discussions, felt we can contribute to the need to connect this knowledge better and make it sort of more readily available. And this is why we have in the pipeline also a plan to launch soon a European Climate and Health Observatory, which would be one of the key deliverables of the new adaptation strategy, to improve the knowledge base, connect and pool knowledge, expertise, tools, organizations, facilitate learning across countries, and support sort of our policy making at the EU level, but certainly also at national, regional, and local levels. This observatory is a partnership which is led by the European Commission, well, our Director General and the DG Santé, Health and Consumers, and the European Environmental Agency. We have several other partner organizations on board, host the portal of this observatory on our Climate Adapt platform. The coverage will be the 32 EEA member countries and 6 cooperation countries. And as I said, we expect to launch the pilot version in February, March 2021, sort of around and soon after the date of adoption of the adaptation strategy. Now, we are a bit short of time, George. I wonder whether I pop up the pilot website of this portal to walk you quickly, just give you a short glimpse, or whether you would actually rather preserve that time for debate.
Well, no, please carry on, Peter, if you can be brief, and then we can use that as part of our discussion.
Very good. Okay, let me click on the link and hope it works. I hope it works. Coming on. Excellent. Seems to be working. Great. So as you can see, this is sort of hosted on the Climate Adapt platform, the beta version of the European Climate and Health Observatory. So this is a development page, which is currently still a work in progress. You see here the home page, plus traditional menu. Now, speaking about the partners of the observatory, as I said, sort of the management group and the lead is the European Commission and the European Environment Agency. Observatory partners, we're really glad to have sort of already sort of the endorsement and active contribution of the Copernicus Climate Change Service, the European Centre for Disease Prevention and Control, the European Food Safety Authority, the Lancet Countdown, and the World Health Organization, in this case, the Regional Office for Europe. In terms of, well, there will be some parts on the policy context, but what's also important, I think, most of us come from a sort of a national angle or a country angle to these questions. And so there will be a country profile. There will be a country profiles for all the participating countries. And if you just go on Belgium, because I sit in Belgium, let me click on that. Let's see, Belgium coming online. And what this section does for the time being, it pulls together information on health and climate change, mostly from an adaptation angle on Belgium, from the different knowledge sources which we have at our disposal right now. Evidence on climate and health will be a very important section, of course. Let me just go up here. There will be a section on indicators, and you can see here a number of indicators which are already on this development version. And for example, if you just click here on the risks or climate suitability for dengue transmission, you see sort of here embedded into this page and using data from the Lancet Countdown, sort of the risk data on the geographical map, so in a geographically explicit manner. There is also an urban adaptation map viewer coming from the local angle. There is already sort of an urban adaptation tool on Climate Adapt on the adaptation platform. And what we do here is we pull out relevant information, again, in a clickable and mostly geographical explicit format, which is relevant to support urban adaptation efforts. Well, I'm not waiting for this to come on, but basically, yeah, you can see, you can sort of scroll into this, and these are risks like coastal flooding, river flooding, water scarcity, droughts, river flooding, high temperatures, and all that. Then there is the European Climate Data Explorer. Now, this is a page which is still under development, but which eventually will house, once again, sort of hopefully instructive and informative graphs, tables, and diagrams, drawing on data from Copernicus and the Copernicus Climate Change Service. There will be a resource catalog, which brings together all the knowledge and evidence sources on climate change and health. And already this is populated with right now 280 knowledge sources, and you can sort of group them and view them in different ways. Of course, this is sort of a living and ongoing effort, and collection continues as we speak. And so on the Climate Adapt page, and later on again on this portal here, there will be a section which allows you to share your knowledge and reports with a view to sort of putting them onto this Climate and Health Observatory. Now, this is a beta version, and this is sort of a Mark I version in a way. We have been doing this last year with available resources. We are making, we are trying also to put this on a much more stable resource base, both in terms of staffing and financial resources. And we're very hopeful that we get there. You know, after the launch, I guess there will be a period of reflection again on what to do next. But what the improvements which we have in the pipeline right now are already updated country pages with input from WHO. We plan that will be a core project, a full indicator-based report, ideally an annual report on health and climate change in cooperation with the Lancet Countdown. As I said, indicators from the Copernicus Climate Change Service. Further pages on health effects, a continuous expansion of the resource catalog, and an outreach through webinars and videos. So with all that said, I hope you found that quick walkthrough policy and our observatory interesting. I give back to you, George, and I look forward to the discussion. Thank you.
Peter, thank you very much. You lived up to what's coming soon. Thank you. The theme throughout all of these talks really has been research giving evidence, education, and then policy being the major outcome. And it looks to me very much as if the EU is leading now internationally in this, and that's the value of a group of like-minded nations. The 10 important reports have led to the Observatory, and the Observatory is going to be a big reference and of great use to politicians and to evidence seekers, Peter, and we thank you for that. FIAM has been involved recently and is progressively involved in strengthening the ECDC, the unit in Stockholm which carries out up-to-the-minute surveillance of infection and trends. And this is going to be a great help in the future in order to predict just what the trends are and what potentially is happening. Well, there's a lot to discuss, and I'll hand back straight away now to Michael, the moderator, who will lead. And I know there are some questions that are coming through on chat. So over to you.
Thank you very much, George. Yes, and thank you to our speakers. We've covered a huge amount of ground there, and it's great to see so many participants not only submitting questions, but also still with us, following very closely, clearly, all the way through. Don't hesitate. If you still have questions, there's still time. You can send them in the chat, and I will bring them into the discussion. But I wanted to start quickly with a question that came in from Rex Horgan. And Robin, I wonder if you might like to take this one. Rex asks, and we saw this very clearly from slides from Andy on the COVID response, the varied differences in terms of climate-friendly policies from country to country. He asks, does the international response to COVID show that we are not all in it together, or precisely the opposite, in fact? Yeah, Robin, I wonder if you have some thoughts there on,
yeah. Thank you for the question. Insofar as it didn't get covered in my presentation, I needed to think about it for a couple of minutes. I think the first point is that in terms of the perspective from the scientific community, there has been a tremendous global commitment, and that is, to a significant extent based on collaboration worldwide. So I think the scientific community can show some examples during COVID of having work together to share data, to develop critical mass, to examine quite critically some of the initial claims, for example, the major interventions in COVID. Some of those may be even based on vested interests, commercial or political, and perhaps supporting the point from the questioner that there is a diversity of perspectives, some based on vested interests, which will militate against all being in it together. But I think, from the scientific point of view, we have a great resource to challenge those vested interests, to challenge misinformation in COVID and climate change as well, for example. Clearly, there are, in terms of response to COVID, which wasn't part of my talk, but clearly that there are issues facing us now, for example, the equitable distribution of vaccines or other interventions. We know that the European Union is trying hard as part of the global arrangements to support equity. There will still, of course, be national perspectives leading to controversies and disputes. Not least today with regard to the supply of vaccines within the European Union. There are significant problems here. Whether we are all in it together, I would actually just come back to a point that Andy made towards the end and that others have picked up. That if we're looking towards the fiscal stimulus for a post-COVID recovery, then we can see from the figure that Andy showed, and of course he could speak much better about this than Peter picked it up, that the countries are varying in their response with regard to the likely relevance of that post-COVID response to sustainability, to climate change, but also to equity. And clearly that there are still disparities in the objectives for equity. So in that regard, I also support what the questioner said. But just to repeat my point, the scientific community does itself have great opportunities to work together.
That's it. So we're hoping that this solidarity and coordination can be reflected in policy as it is in the evidence. Yeah, absolutely. Yeah, I wonder if anybody else would like to touch on that. Peter, your slides on the fine particulate matter was very striking as well on this front, that there's a real gap between different European countries in terms of the issues at stake. Is this, I can imagine it's posing a huge...
Well, yeah, it is. And I was just reflecting on the question. And the sad truth is, of course, that poor people tend to always suffer from any health problems more than the rich, and so that's unsurprisingly is the same for COVID. And we have now sort of a real turmoil, socially, but also economically, and so that would be, I guess, the first world crisis where huge distributional conflicts would be solved sort of in a non-problematic and peaceful manner. So of course, there will be a set of winners and losers in this, and a lot of the relevant policies are policies which are a prerogative of member states and are being dealt with even at the city level. And I guess as EU, what we can do is, of course, and we can, we fortunately achieved agreement on the next multi-annual financial framework. 21 to 27 with 1,074 billion euros, and the next generation EU program with another 750 billion. And so I guess the intent is to buffer really this turmoil period and to steer it into less troubled waters and towards sort of the Green Deal vision, if you want. And I guess that will go definitely some way to help. But it's not a panacea. That's quite clear.
Yeah,
Another aspect which I see here, and which I'm glad absolutely. What I fully agree with the idea that what Robin said, that science. I mean, we are blessed that we have the science, and this huge international effort of scientists to unravel the genome and work across countries and world blocks on vaccines and treatments. That's fantastic. It's a great story. Another great story, which I think is really that countries initially had the reflex of renationalizing, healthcare and closing their borders and keeping the vaccines to themselves. And that we are in a situation where now sort of vaccine procurement and distribution is something which is centrally steered, is encouraging.
Yeah, it was interesting to see how much of a focus was right across all of your presentations on vulnerabilities, resilience, but the social justice angle seems to be strongly enmeshed there, both on the health and climate side.
Michael, if I could just add something there, that there was a very interesting case in the UK a few weeks ago of a child who died of asthma, and the coroner allowed to go on the death certificate air pollution as being an important factor contributing to this 10-year-old's death. And this caused a huge public outcry because it was in all the newspapers. And it really raised the public's attention to the importance of the air we breathe. And Andy gave those figures showing the number of lives that could be saved. And I'd just like to agree with Peter very much that research and science leads to evidence, and evidence leads to policy. And this is a continuum. It is not siloed, and we must really, really make sure that that works. Over.
Thanks. Yes, and Andy, actually, I wanted to come to you. There was a question, Andy, that came in during your presentation regarding EU policy tools such as the Farm to Fork strategy, the European Green Deal. The question was, what improvements would you suggest to these strategies? Is there anything you would highlight as room for improvement within these sorts of policy initiatives?
Well, in every strategy, whether it's the EU or at different national levels, you always get, of course, special pleading from very powerful vested interests. And I suppose if there was one thing I would say is, let's not make the EU Farm to Fork or indeed the Green Deal hostage to special interests. They will have to be faced down at some point. It's inevitable when you're moving towards a zero carbon economy that you are going to tread on some toes of very powerful interests, whether it be the fossil fuel industry or some elements of the food and agriculture sector as well. So you have to face up to that. And I'm not a politician, so I can't tell them how to do it. But I do think that they would have, in general, politicians would have a lot of support if they do stand up to powerful interests and say, this is the direction of travel we're going to take. We understand there will be some short-term winners and losers, but if we redirect our economy towards a more sustainable approach within planetary boundaries, but putting health at the centre and well-being at the centre of our economy, then it will be better for all of us. So I think we need to keep making those arguments from a scientific perspective, and then hopefully politicians can then use some of the arguments to really scale up the pace of change. Because at the moment, there's a lot of rhetoric, but I'm still concerned that there isn't enough reality on the ground. And a recent initiative we've just started is called the Pathfinder Initiative. It's also a Lancet funded by the Wellcome Trust. But the objective is really to capture lessons around the implementation of policies, technologies, interventions to rapidly decarbonize the economy. Because we want to get beyond the mathematical models of what we need to do, or indeed the statements of political leaders of the direction they'd like to travel in, to see what's actually happening on the ground. And unfortunately, when you look at that, you often find that progress is slower on the ground than one would like to see. So we need to ask ourselves, how do we accelerate the pace of implementation? And that's a key question, it seems to me. Part of it is in the realm of financial, tax and subsidy withdrawal.
And that's something I'd love to hear from Karina about. How can the chief scientific advisors to the Commission help to achieve the types of challenges that Andy's talking about? So, for example, equipping the Commission to make policy when they're up against influence from big interests of various types, but also linking policy to real action on the ground. Karina, I wonder if you have some thoughts on that.
Right. Well, of course, that's a very difficult issue to have very clear thoughts about. I mean, if I look at the recommendations we have, it's a lot about the integration, as I described. That actually, if one looks at issues in unison rather than apart, then maybe other policy options emerge. And I'm thinking, we talk a lot about COVID now, and maybe if one is to find something positive with this COVID situation, is that maybe it becomes apparent that, yeah, we need to change. We can't go back to doing things maybe exactly as we did before. There might be other epidemics. There is a need to, if we looked at the health situation, do some of the recommendations that are suggested, supporting the resilience of the health sector, looking at vulnerable groups such as elderly who have been heavily hit in many countries. So to some extent, and if I were to look, at my own schooling as a professor in political science, there's of course many theories that suggest that it's events are a part of what drives actual change. So now that we have seen events around health, maybe it's easier to motivate them and to make these connections as one sees that these connections are really needed because they come into effect. There are these impacts on elderly. There are impacts that make issues of building, design, infrastructure very clear that this is needed. And there are really impacts on the most vulnerable. So I think that's most of the things I can say. And it does also seem that we are seeing a movement towards looking more in a sort of broader direction of policy taking in many issues. Yeah, thank you.
Thanks, Karina. And I think it's an important point to end on. I'm sorry that we haven't had time for more discussion, but I want to make sure that we hear from George as well for some final thoughts. So thank you very much, participants, for your questions. And thank you as well to our panelists for getting into the discussion so nicely. Thanks very much. And over to you, George.
Clarity of numbers, clarity of the problem. And finishing up really with saying, we now have the reality very clearly documented. How can we increase the pace of things? Now, of course, this impinges, as Andy was just saying, on politicians really being on the side of change and increasing the speed of change, of finance, and that could be tax, of change in public opinion, using energy in different ways. But I think today has shown that the strategic aims now are very, very clear. Carbon neutral. The 5 domains of the COP26 program have helped a great deal to rationalize where we should be going. And WHO backing that up with their 6 programs. Peter really said that adaptation is crucial across individual states and then across into the global domain. Now we have these 10 important reports coming up into the Observatory that Peter mentioned. It's complex when you get 10 reports, of course, and each one of those I know will have a good summary, and it's our politicians who need to become aware of those things. Health has been a dominant feature that we started off with through Robin and then Andy. The health of children, of course, we don't know what air pollution is going to do to the development of children's lungs in the future. We know lungs develop from birth right through to the teens. They're still growing and developing. If that growth is impeded in any way, there could be huge problems for the future. We know chemicals cause malignant disease as well as viruses, of course, and we yet have to try and understand how climate change influences that. But undoubtedly, the air we breathe is going to be a crucial thing for the future. The oceans, and Andy mentioned seaweed being very important, well, potentially very important as a way of growing nutrition with ease. This could be quite straightforwardly harnessed and is being harnessed, I know, in the north of Scotland. So really what comes out to me is the number of people who've actually signed in to be part of this discussion. There were over 50 people who wanted to listen, which for a Zoom or a WebEx is remarkable. That shows the importance of evidence and education of children for the future, I believe, is very important. And this will lead to international cooperation. So let's hope that the example that academics are showing, let's hope that the example that the EU politicians are showing is leading towards a really integrated front for the future. And just once again, to thank you very much for your fantastic talks, wonderful slides, and to thank the moderator, Michael, and the organizers for really getting to grips with this excellent symposium. So I have nothing else to say other than let's keep at it and make sure it works. So well done, everybody, and thank you very much indeed.
Thank you. Goodbye.
Bye-bye.